Gilmore. I'm going to be your nurse today. Let me grab some gloves. Do the hand wash. Okay, can you give me your full name and date of birth for me? Sandra Williams, 0426. Perfect, thank you so much. Okay, I'm going to lift your bed and kind of explain what I'm doing today, okay? Is that okay? Perfect. Just don't want to be reaching over you all day. Okay. I'll lift you up a little bit like this so it's easier to talk to you. Okay, so today I'm going to be administering some medications for you to help with the pneumonia and stuff. So I have some normal saline. That's just going to be to hydrate you and keep your electrolytes balanced and stuff. And then I have levothyroxine. I have some points I want to say. It's for the infection for your pneumonia. It's going to help you get better and clear that up. I do want you to let me know if you have any rash, dizziness, or lightheadedness. Those are basically the main symptoms, and if that does occur, then you can give us a call and we'll kind of help combat that, but it will help with the infection. And then we are going to give furosemide. So that's going to help with the fluid that's built up in your lungs from the pneumonia. So we'll give you that, and if you have like excessive urination, drowsiness, dryness of mouth, kind of the feeling of dehydration, let us know and we'll kind of give you some more fluids and make sure you're okay. That sound good? Okay, perfect. So I'm gonna start scanning this. You did already give me your name and date of birth, so we're gonna go here. We're gonna go to the MAR. I'm gonna scan your little barcode, hopefully. Perfect. So I scan that. I'm going to scan the levo. Okay. So it is the right drug. The dose is the 500 milligrams per 100 milliliters, and so I'm going to be doing 100 milliliters per hour. That's going to be your piggyback. So that's right, the route, piggyback. And time is 10:40, which is exactly when I'm supposed to be giving it to you. I did already do the 3 checks with you. Your name and date of birth have been said. And we're going to say birth date, and we're going to say administered. Now we're going to do your furosemide. And you're okay again taking all these medications? Good, it will help you. We have the right dose, which is 5 milliliters push for a minute. Route is going to be through your IV port. It's going to be the right time, which is 10:40. And we have those 3 checks done, and you gave me your date of birth. So that's perfect, and we're going to put administer. Now we're going to do the normal saline. Ding! We have the right dose, the right time. You said yes for the normal saline, so that all should be good. So before I do anything with your IV, I am going to put my gloves on and just kind of get the furosemide set up so it's a little easier for me. Just set up. I'm going to check everything else in a little bit. Okay, so we don't have any furosemide in the bottle, so I'm just gonna verbalize getting it and put it in there. So we're gonna take that out, we're gonna stab, we're gonna lift up, and we're gonna pull 5 milliliters. Even though it's there. Perfect, so that has the 5 milliliters in it. We're gonna recap that so it stays clean. So now that this is ready, we're going to get my little alcohol wipes. I'm gonna verbalize. I should have wiped this down for 15 seconds. Okay, So now I'm going to check for redness and swelling. Okay, perfect. The IV line looks very well. I'm going to clean this for 15 seconds. So are you having any coughing or anything? A dry cough? Okay, so it does sound like we're getting better. Sometimes they have a little bit of flu. Okay, perfect. So with these antibiotics, we'll get that set right. Okay. Okay, 15 seconds is almost done. Perfect. So we're going to put that right there. That did drop. I'll have to get another. Well, the flush. Cool. Flush dropped, but I have one more. So this is clean. 15 seconds was clean. We're going to aspirate, see if there's any blood. Perfect. And then we're going to flush and see if the IV is intact. No leaking. We're going to do about 5 milliliters. Perfect, I don't see any leakage. We're going to put the screw back on so it remains clean. And keeping control of this, we're going to take your levo, and it does say to do it for a minute. So we're going to unscrew the red cap. That was not a proper. That is bad technique. So we're going to put that down. We're going to have to wash it again because this is stuck. We're going to have to get new gloves. Okay, now that's off. We're going to keep it on the clean area. I'm going to re-glove and re-sanitize. Perfect. Want to keep it clean. Okay, now we're going to try again, and we're going to push for a minute. So I am going to get a new alcohol wipe, clean that for 15 seconds, because unfortunately I had to drop it. And don't mind my non-one-handed recap. Okay. Yes, I know 15 seconds does seem like a long time, but hopefully we'll get this medication going pretty soon. Okay. 15 seconds, kind of let it dry while I get this. We're going to connect it to your little port. And for a minute, we're going to start pushing. Yeah, I know. Pneumonia doesn't seem very good, yeah. I know, your lungs are probably breathing and stuff that probably doesn't feel very good right now. Have you been trying to do incentive spirometry like we taught you? Yeah? Well, that's good. A+ student right there. We'll do some more deep breathing kind of exercises to help you out here shortly, okay? Okay. We're almost done with the first thing. Perfect, we have that administered. Won't need that. So now we're going to try to set up the primary line. So I'm going to move this out of the way so I can get behind there. Let's see. Okay, trying to move this. Ooh, excuse me, sorry. We'll move this right here. Okay, so we're gonna grab the primary, keeping control of the ends. So since this hasn't touched anything like so, I am gonna keep this wrapped for right now. And this hasn't touched anything, we're gonna take this out. We're gonna unscrew this, still clean. We're gonna puncture our bag. Perfect, we're gonna make sure our thing is closed for right now. We're gonna hang it up. I personally like to hang it up and then prime it hung up so I don't hold anything over the trash can. This is where I'm gonna kind of loosen it just a little bit. Not too much. Okay. Then we're gonna squeeze half. You still doing okay? Yes, perfect. I'm glad to hear. We're gonna start slowly undoing that. You can see the liquid going. We're priming. Do you have any kids or anything? Yes. Awesome. Okay, so we have this prime now. Use this as a name tag because I forgot my little name tags. And we'll label that after, but we'll use it. Okay. We'll use this one too. Okay. Perfect. So we're going to clean your site for another 15 seconds. I know it is a lot of cleaning, but you know what? We're not going to leave here with another infection, are we? No, we are not. So we're going to clean for another 15 seconds. Good thing is, it should be the last time we do it on this one. So we're cleaning, cleaning, cleaning. I love your hair, by the way. The haircut, phenomenal. Might have to ask you what salon you go to. Waves. Yeah, I might have to make an appointment there. It's beautiful. Okay. So now that the clamp, oh, we got a tangle. Okay, so now that the clamp is clamped, we're gonna connect you. Nothing will be flowing yet, okay? Might be a little cold, kind of how the flush was. Start off with, just make sure you got your blankets and stuff. Open this bad boy up. We're gonna turn her on. We now get to listen to some fun hospital sounds. Yeah. Put that in there. And we're gonna try to close this without breaking it. Okay, so our order today is gonna be 50 milliliters per hour. So we're gonna say yes. You are a new patient, you are in med-surg. We're gonna confirm your name. And we're gonna put channel select, IV fluids, normal saline, yes. And we're gonna do 50 milliliters per hour. And we're going to put 450 because we've kind of lost some. We're going to start that. We're going to make sure it starts good. Okay, give me one moment.